Our next guest speaker via Zoom, John Rowley, who is from the IBEW, International Brotherhood of Electrical Workers, Verizon in Massachusetts. And John did a study along with really prominent doctors and professionals in the healthcare industry. And John Rowley is going to explain that all to you next.
I accepted the invitation today because I believe somewhere, at some point in time, perhaps today, an individual, a small team, or a large group of people will find themselves in a position to address the issue of lead and its health hazards to a fuller extent than has been to date. There are places where lead exists. That lead can only lead to serious health problems for workers and the public, and that remains largely unaddressed. On July 17th of 2023, I received a phone call from an active member whose job put them in close contact with lead cable on a frequent basis. He asked if I had seen the article in the Wall Street Journal. I had not, but told him I'd investigate and back to him. The next day, I received similar calls from retirees asking what I knew. So what do we know about lead? First, we know that there is no known safe level of lead exposure. However, there are regulatory agencies in the U.S. that have certain allowable thresholds. We also know that lead is not water soluble. That scientific fact plays a vital role in the telecom and utility industry. If lead levels in the air are not constantly being measured, how does a worker know that they exist in the first place? They do not. Those standards that were set in 1978 are the same now in 2026. So the acceptable exposure levels of lead in the air in a workspace have remained unchanged since Jimmy Carter was our president. Every administration since 1978 until today have not updated the OSHA regs related to lead standards. Fortunately, our medical advancements, technology, and treatment have improved over the last 48 years. So a quick description of who was involved. So we have the Occupational Safety and Health Administration, otherwise known as OSHA. And then we have NIOSH, the National Institute for Occupational Safety and Health. And then we have the Environmental Protection Agency, the EPA. So we have three distinct agencies that oversee and are connected to this lead issue. The CDC and medical standards on blood lead levels have become almost 90% more stringent since 1978. The OSHA standards have not changed. Why is that? Who benefits and who suffers? OSHA standards allow corporations to accurately state that they are indeed following OSHA regulations and thusly are protected. That offers no consolation to any man, woman, or child should they suffer health issues due to outdated regulations. But we have another part of the problem, and this is not my opinion. This is what was explained to me by experts, two gentlemen that I got to befriend and learn much from over the years. Dr. Jack Caravanos of New York University and Professor Philip Landrigan of Boston College. I was introduced to Jack in August of 2023. After several conversations, I scheduled a meeting with Jack and one of his NYU students to visit locations within Western Massachusetts. That occurred on October 17th. He took several measurements with his X-ray fluorescent tool, which is a handheld spectrometer that measures the presence of leads and other metals in the ground. They also hand dug several samples to review back in his lab. These tests and samples were all conducted in and around aerial lead cable. Levels above the EP acceptable limits were found in each town and city we visited. In January of 2024, Jack introduced me to Professor Philip Landrigan from Boston College. Professor Landrigan is known as one of the people who helped get lead out of gasoline, so that's how long he's been around and the depth of his involvement in lead. After some discussions, both Jack and Phil agreed to attend a site visit for a live X-ray fluorescent test and a panel discussion with Senator Edward Markey. Senator Markey's staff had contacted me in November of 2023 and asked if I could assist the senator in a joint project, one aimed at bringing something about the lead issue. On February 5th of 2024, Senator Markey visited Chicopee, Massachusetts for a live inspection on plain, ordinary ground under lead cable. The tests were indeed above the updated 200 parts per million set by the EPA. This was the first time that the EPA, OSHA, and NIOSH had been brought together in the same room for any investigation. So what do we know about lead in question? We know what happens. We have snow and we have rain. It gets collected within manholes, flow through the ducts, and then through the conduits. And those conduits sometimes have been made of asbestos and other materials over the years, and it's been in the ground since the 1920s and before, and certainly afterwards. Telecommunications industry ceased using lead cable in the 1960s. There are arguably still hundreds of thousands of miles of it within this country. What else do we know? We know that arguably we want to leave lead alone. It's most dangerous when it's disturbed and its particulates become airborne. So also what we have to talk about a little bit is when we hear about the blood lead levels. So a lot of people asked about getting their blood tested for good reason. However, a blood lead level test is good for only about 30 days. That's its half-life in your blood. Then it's excreted through bodily functions, and some of it travels through soft tissue and organs for another month or so, and then finds its way back into blood, and then that continues that process. For some, however, it finds its way into their bones, and there it stays. The only known way to remove it is through chelation, which is an incredibly dangerous process. Bone lead testing can be done with X-ray fluorescent spectrometers, which are safer than your basic X-ray. So, how many days did you go to work feeling fine and come home with a pounding headache? Maybe it wasn't from lead exposure, but maybe it was. Did you develop hypertension? Maybe it was genetics or diet, or maybe it was from lead exposure. How many have become ill, impaired, and suffered a premature death? I cannot be convinced the number is zero due to lead exposure. That is my question and concern, and we've only scratched the surface with this investigation. Again, why? Because there is no known safe level of lead.